So there's two treatment goals when someone has erosive esophagitis. One is the management of symptoms. So if you're having heartburn or acid reflux and that's making you uncomfortable in your daily life, we want to reduce those symptoms. And we can do that with a variety of medications as well as lifestyle changes. The other goal is to heal the esophageal lining, because if you have ongoing ulceration and damage to your esophagus, it can lead to all kinds of very serious consequences. So there are several medications that you can use to treat heartburn, acid reflux, and even erosive esophagitis. So these can range from antacids, which are short-acting medications that really are used mostly to address the symptoms of heartburn, and they're most appropriate if you're someone who has heartburn symptoms once every couple of weeks and it's not very severe. These are short-acting medications that will help you feel better, but won't really do anything to protect your esophageal lining. So for people who are having frequent symptoms of heartburn, maybe a couple of times a week, or the symptoms can be pretty severe, something like an as-needed histamine receptor antagonist class of medication can be very helpful. These medications work in about 30 to 60 minutes, and you don't need to take them every day. You can take them kind of as needed. These medications mostly address symptoms and aren't the best kind of medication to use if you have severe damage to your esophageal lining. Proton pump inhibitors are a class of medication that is probably most often used to treat things like acid reflux, heartburn, and even erosive esophagitis. The way that it works is that it irreversibly blocks the pump that's on the cells of your stomach that produces acid and prevents it from working. Not only do these medications work very well to help people deal with their symptoms, they actually lead to healing of the esophageal lining if you have erosive esophagitis, and can prevent long-term complications from this. So potassium competitive acid blockers are a new class of medication that's emerging to help treat symptoms of heartburn, acid reflux, and erosive esophagitis. If people are having symptoms of heartburn or acid reflux, it can also play a significant role in helping the esophagus heal from erosions or ulcerations. For people who have symptoms of heartburn or acid reflux, there are many different classes of medications that you can try. Different people will respond very differently to these classes, and some classes of medication may be more appropriate to one person versus the other based on their medical history and the severity of their symptoms.